Well, according to the CDC, more than 3 million older adults visit the emergency room each year due to falls. Now, there are a few easy things we can do as older adults or caregivers to help prevent those falls. Synergy HomeCare Gerontologist Dr. Macie Smith is here to share more. Dr. Macie, it's so good to see you. How are you?
It's so great to be here again, Claudia. Thank you.
Absolutely. Well, first off, why does the risk of falling increase as we age?
A myriad of reasons. Many of our seniors are taking medications that could cause disorientation, drowsiness, confusion. That could lead to falls, and so it's great for seniors to get a falls assessment from their doctors annually.
Okay, what kind of conversations should they be having with doctors when it comes to really understanding those fall risks?
And really, physicians, if they're a geriatrician or if they're caring for the senior population, it should be a part of their routine assessments at the senior's annual examination. And so even though we know that doctors don't remember everything, we're not their only patient, although we like to think so. We're not. It is incumbent upon us as caregivers and also incumbent upon the senior to really recognize some of the fall hazards within their environment so that way they can secure them or remove them to promote a healthy lifestyle for themselves to reduce the risk of winding up in the hospital. A hospital is no place for a senior. If you gotta go, go, but get out of there as soon as possible.
Okay, see, that's good advice, and you also bring up a good point. Let's start at home with the things we have around. What are those things that could be a danger?
So one of the things is a drop cord. So I'm from the South, so I say drop cords. The other people in the city, they say extension cords.
Okay.
So the extension cords, the throw rugs, you want to remove those throw rugs or you want to secure the throw rugs. Look in your bathroom. The bathroom is one of the most dangerous places you will ever want to fall because of the porcelain, because of the sharp edges. You want to make sure you have the raised toilet seat, the bath bench, also the grab bars. They're very, very, very important. And then, you know, it's spring coming up, right? The sun is in the air. Also, the pollen is in the air. Everybody's wanting to get out. So you want to be sure that you're staying active as an older adult. When you stay active, you're strengthening your muscles, you're improving the coordination, you're improving your balance. Yeah. And you also want to ensure that you're staying engaged with your loved ones, you know, being around people and ensuring that people are around you and being able to assess what you're going through, because somebody else may see some balance concerns that you may not have recognized, or either you wanted to like push it to the back of your brain. And so you want to be sure that you're staying engaged with family, friends, and loved ones. And Claudia, let's not forget about our eyes. You want to be sure that your eye examinations are up to par, at least annually, but as often as needed. When we look at, as we get older, starting at 40, over 19 million Americans over the age of 40 are dealing with some level of age-related macular degeneration. So it doesn't necessarily mean over the age of 65, because every day we're aging. So you want to make sure your vision is up to par. You want to make sure that the house is well lit so that where there are not any dark spots that could actually increase the person's risk for falls.
Okay, all of that is great advice, and we need to hear that again, because these are things that we could forget and then be looking at bad situations. What other kinds of things can we do to prevent those falls, especially as we get out more, Dr. Macie?
You want to be sure that you're wearing sensible shoes. I mean, I know you're saying, well, that's common sense. Well, actually, it's not, especially when it comes to the ladies. You know, you may want to invest in the lower heels or the flat heels. They still have some cute flat heel shoes out there. So you want to be sure that you're not putting yourself at higher risk based on your wardrobe. You also want to keep in mind certain times of day that's appropriate for you to get out. If you don't do well at night, you don't need to be driving at night. You don't need to be going out at night alone unless you're with someone else who is driving. Sometimes, Claudia, people don't do well at the height of the day when the sun is really bright. You know, there have been a lot of car accidents when the sun is like setting, you know, because that sun is in your eye. So you want to be sure that you are scheduling the things that you need to do and the things that you want to do around certain times of day that are amenable to you to be able to function optimally, again, to reduce your risk of accident, injury, and falls.
So true. Well, great information. Thank you so much, Dr. Macie, for being with us this morning.
Thank you so much, Claudia, for having me.
Absolutely. And that is Dr. Macie Smith, everyone. For more helpful tips and to get a free fall prevention guide, all you have to do is go to synergyhomecare.com.